A newly released report shows around 80% of deaths in South Korea are due to chronic diseases. Cancer is the most common cause of death, followed by cardiovascular and respiratory diseases. Seung-jae with more.
Approximately 8 out of 10 deaths in South Korea last year were attributed to serious long-term illness. According to data from the Korea Disease Control and Prevention Agency, 79.6% of all deaths in the country were due to chronic diseases in 2021. The remaining 20% were caused by infectious diseases or injuries. Specifically, cancer accounted for 26% of all deaths. That was followed by cardiovascular diseases, chronic respiratory diseases, and diabetes as the most common causes of death. Chronic illnesses like hypertension and diabetes increased roughly 2% from the previous year. Data shows that South Korea are smoking less than they did 10 years ago. And in fact, the number of smokers in the country decreased by nearly 7% compared to a decade ago. However, there's been an increase in alcohol consumption over the years, combined with an increase in obesity during the COVID-19 pandemic. Because of this, medical expenses related to chronic diseases amounted to over $49 billion in 2020, accounting for 85% of total medical expenses.
The number of deaths and diseases due to chronic diseases is increasing. Therefore, active health management is required on a daily basis to comply with chronic disease prevention management rules and to form a healthy lifestyle.
The KDCA says it plans to identify the status of chronic diseases and health risk factors each year and use them as a basis for establishing related health policies. Seung-jae, Arirang News.